Skin Esteem Med Spa. Headed by a nurse practitioner and featuring a staff of physician assistants, nurse practitioners, and nurses.
Now your kids aren't going to know when you're mad at them anymore.
Skin Esteem will make you look beautiful, glow from within in a safe and healthy way. Hi.
Hi, my name is Dawn Naylor, Alika. So nice to meet you.
Nice to meet you too.
We have a menu service here that if you'd like to look at it, tells you about all the options that we have.
Wow, you offer so many options. How about you give me a tour?
So welcome to our practice.
Thank you.
These are just some of our certifications here. Our name is trademarked. We have a laser safety certification. So it's really important for us to have these. Over here are a bunch of awards that we feel blessed to have won over the last several years since we've been open here. We're very excited.
Yeah.
Best Med Spa. We runner-up for Cape Cod, which is wonderful. We have a lot of patients that come from Cape Cod, and I used to work at the hospital down there, so we have a lot of nursing staff that we're very close with still, and we have a lot of people that cross the bridge, so very fortunate. One of the best parts of working at a med spa or an aesthetic practice is staff treatments. We don't take nearly enough time to treat ourselves, so here are two providers, amazing providers, are going to treat each other, which is wonderful.
So what Holly was using is a little vibrator tool that essentially is meant to distract you from the feeling of the needle. The distractor tool really takes it away. Some people say they hardly feel it at all when we use that, which is why we use it.
And what's your perspective?
I have been coming to Skin Esteem Med Spa for about 8 years. I started with Botox, and then I moved on to trying to repair the outer surface of my skin. So I started doing RF microneedling treatments, and my skin has basically went back.
I come here mainly for the skin care aspect of this wonderful facility, and I really feel like I've learned a lot from all the knowledgeable staff of what things work, what things don't work, what things I should add to my routine.
Dawn is so completely knowledgeable, always ahead of the curve. She's educated in every aspect of her profession. I just love it here.
One of the first things we tell people when you're new to these kind of treatments is it's important to know that you're at a reputable place and that you have a reputable provider.
Okay.
I have 24 years experience and I've owned this practice for over 8 years. I've been injecting for nearly 20 out of the 24 that I've been practicing. We also collaborate very closely with a plastic surgeon, an oculofacial plastic surgeon, and a dermatologist.
Oh.
Because we treat everything from non-invasive lines, wrinkles, to things like migraines, sweating in the armpits. That's another popular one, sweating of the hands, and even people who have Bell's palsy or some medical problems we treat. One of the things we do pride ourselves in is that we do treat all skin colors. This is important. We tell people we don't see skin color. What we see is a skin type.
Oh, okay.
We use these colors because inherently people that have darker skin types are higher risk for scarring, keloid scarring, and also post-inflammatory hyperpigmentation. When I do an assessment for a patient, one of the things I do is I break out my little model here, which I love. We call her Vena White. So our customers actually labeled her. But this just shows people, we tell people the biggest risk is bruising, but I think people need to understand what's underneath the skin. But the muscle we're going to treat here today is this region right here. This region is also responsible for a lot of people's headaches. So it just helps release a little bit of that, what we call, resting annoyed face.
Yeah, because I think a lot. Mm-hmm.
And also it can help with some headaches and migraines in some people and even depression.
It can help with headaches?
Yes.
Ooh.
Our point is that this is something you need to take seriously. It's your face. It's not a drive-through where you're getting a cup of coffee. You need to do your research. Nobody should be giving you a quote for neuromodulators or toxins over the phone because they can't assess your personal muscles. So, we do have guidelines based on studies, and that's where we come up with recommendations for anything.
She's smart.
That's why if our price is a little bit more than someone else down the road, the question's why? Well, usually it leads to, it's training of that provider.
Well, it might cost a little more, but if you go somewhere else that's cheaper and then you have to come and get it fixed anyway, that's going to cost you more money.
Exactly.
I want to say that I've never had any of this done before, and I've trusted Dawn so much since meeting her that I'm willing to do this on camera for you.
So we're just going to wipe you here. You're going to make a mad face for me. And then you could see she's got a little bit of I want to just really make sure I'm getting it right in there. And that's it. So you should start seeing results within 1 to 2 weeks, and that's it. Now your kids aren't going to know when you're mad at them anymore. You're going to be like, "Rrr," and they're not going to be able to tell.